Hello, we are group 2, and for our project we got Streppharyngitis.
The pathophysiology for Streppharyngitis is an acute infection of the pharynx caused by group A beta hemolytic streptococcus. After it enters the upper respiratory tract through the droplet transmission, bacteria bind to epithelial cells in the pharynx using adhesins and M proteins. Surface molecules allow the pathogens to resist phagocytosis and trigger infection. Organisms produce invasive enzymes and toxins, leading to cell lysis, inflammation, and necrosis of the epithelial tissue. This results in key indicators of strep throat.
Body's immune response recruits neutrophils and lymphocytes, contributing to local inflammation and systematic symptoms. In some cases, molecular mimicry between streptococcal antigens and human tissue can lead to post-infectious autoimmune and complications such as rheumatic fever or glomerulonephritis.
Signs and symptoms. Strep throat anginitis or strep throat is a throat infection caused by group A Streptococcus bacteria. Is usually being with a sore throat that comes on quickly and can be very painful. A fever higher than 101 Fahrenheit is also common. Other symptoms include swelling lymph nodes in the neck, red and swallowing tonsils, and sometimes white patches on the tonsils. Some people may also have headaches, stomach pain, or nausea, especially children. Cough and runny nose are usually not present, which help doctors tell apart from a viral sore throat.
Risk factors of streptococcal pharyngitis. The main one risk factor is age. It mostly affects children between 5 and 15 years. Another risk factor is in close contact with somebody who has the infection, especially among family members, at school, and at daycare where people are crowded. Another risk factor is season. It normally infects people during the late fall and winter when the weather is very cold, and in spring when there are a lot of pollen in the environment. Another risk factor is poor hygiene. When people don't wash their hands, it helps them to get the disease. Individuals with compromised immune system are also at higher risk for streptococcal pharyngitis because of pre-existing condition.
Complications of the pathophysiological process: cervical lymphadenitis, mastoiditis, peritonsillar abscess, retropharyngeal abscess. Steroids can be used, but only with severe complications like impending airway obstruction or other organ involvement, like the central nervous system manifestations, thrombocytopenic purpura, myocarditis, and pericarditis is evident. If left untreated, the bacteria that causes strep throat can spread to other parts of your body.